What happens when your heart stops pump the blood flow? What will happen when you stop breathing? So hello guys. I hope you are doing well enough in your life. So let's discuss this condition which is called a heart valve surgery. Of course, we are going to discuss this thing into our video. If you like the video, if you watch this video till the end, you will get a lot of information that anyone can give you in a very simple language. Okay, so let's stay with me till the end of the video. First of all, let's understand what is heart valve surgery in a very simple words. Heart valve surgery is a medical procedure to fix or replace one of the valves in your heart. You can see in the picture as well as okay. These valves are like tiny doors that control the flow of blood through your heart. So if a valve is not working properly, okay, because it can be a too tight or a leaky as well as, so the surgery helps make it work better so your heart can pump blood normally. This can involve repairing the valve or putting in a new one. Remember, severe valve narrowing, which is called a stenosis, when a valve becomes too tight, it blocks blood flow. Another one is severe valve leaking, which is called a regurgitation. Okay, when a valve lets blood flow backward, okay, backward, not forward, making the heart work harder. So always you will feel the symptoms as well as there, such as severe fatigue, shortness of breath, chest pain, irregular heartbeat, or swelling in the legs or belly as well as. Another one is risk of complication, which is included in this. Okay, if the damaged valve might lead to serious problem like heart failure or infection. Okay, in the next slide we will talk about the treatment of this condition. So let's stay with me till the end of the video, and don't forget subscribe our channel as well as. Here is the treatment. First of all, repairing the valve. Okay, this is the solution. 1. The surgeon fix the existing valve so it works better. Techniques include patching holes, rasping parts, or tightening a loose valve ring, often done for leaky valves especially. Okay, another one is replacing the valve. Okay, replacing valves means what is means by here, it is a mean that a mechanical valve, okay, made of metal or plastic, last a long time but requires lifelong blood thinning medication as well as. Okay, biological valve made from an animal or a human tissue, yes, of course, it doesn't need long term medications but may need to be replaced over time. So remember this thing. Another one is a minimal invasive procedure. Let's see what it is. Transcatheter valve replacement. Okay, a less invasive way to replace the valve using catheter, common for the people who are not fit for open surgery, fit for the open surgery. Balloon valvoplasty. Let's see, a balloon is used to widen a narrowed valve, often used for temporary relief or in a children especially. Okay, another one is we can say the medicine. Okay, before or after the surgery. So drugs to manage symptoms like swelling, blood thinners to prevent clots in your heart. Okay, another one is the medications don't fix the valve but can improve heart function. Okay, always remember, medication don't fix the valve but can improve the heart function. So if you want to change the valve, you need to connect with your doctor first. In the next video, we will discuss the another topic with lot of enthusiasm and in a very simple language.